viewers, you're watching the Wow Lifestyle Show. My name is Helena. Today we'll be talking about physical activity. Now, physical activity is any bodily movement that makes you expend energy. According to a World Health Organization report in 2011, physical inactivity is a leading risk factor of global mortality. Where do you stand on the risk ladder? We are turning around for a quick commercial break. When we come back, we'll be talking to the experts. Don't go anywhere.
Looking for commercial cleaners in Ghana? Then your only solution is Delete Ghana Limited. At Delete Ghana Limited, we supply high quality, professional, comprehensive and cost-effective commercial cleaning services across Ghana. We have the experience, specialized skills and equipment to clean your offices, commercial facilities, retail outlets and shopping centers, estates, schools, sports venues, etc. Call us now on 020-7756-881.
Welcome back. So we have Dr. Charles Abebio. He's an emergency physician specialist, and we appreciate his coming here. We also have Mr. Richard Kofi Akwa. He's the GhOne fitness instructor, and they're going to help us to digest the topic of physical activity. Okay, Mr. Akwa, we'll start with you. What's the difference between physical activity and exercise?
The physical activity simply means movement of body, and that uses energy. Climbing stairs, playing soccer, walking, stroller of the baby here and there. So if you compare the two, this one is just normal. Everybody can walk. Everybody can climb stairs. That one, you can't compare that one to the exercise, normal exercise at the gym. The thing is, when you go to the gym, that one you are going to build your stamina, your cardio. So we have different types of workout. We have cross trainer, treadmill, aerobics, and the stationary bikes. So if you want to build the stamina, you start gradual process. Maybe the first time you can stand on the treadmill just 10 minutes, then you close for the day. Don't stress yourself at the gym.
Very important.
Yes, because that one is very important. Yeah. So if you want to build a stamina, it's like 10 this week, the whole week, 10 minutes for the whole week. Then maybe the next week you increase it up to 15 minutes. That one you are building the stamina, the cardio. So by the time you spend like 2 or 3 months, you can use the treadmill like 1 hour or 45 minutes. Because that one, you have the stamina.
Okay. All right. So you mentioned some kinds of exercise. What are the different kinds?
The different kinds is, the treadmill is a machine. And the cross trainer too is a machine, one of the gadgets at the gym. But the aerobics, you are using your own body to build the stamina. The dancing here and there with the music. So while enjoying the music, at the same time you are building the stamina. Enjoying the music at the same time building the stamina. So the difference is, the treadmill you are using the machine, and the aerobics you are using your own body to build up the stamina. That's the difference.
So aerobic and anaerobic exercise,
yes.
Is that what
anaerobic exercise is different from the aerobics. That one, anaerobic exercise is you want to build a stamina. Have you seen my biceps? This one, if you want to build a biceps, you need to start working on your biceps. You have a lot of...
That's the anaerobic?
Yes.
Okay.
It's different from the cardio workouts.
Okay.
Yes. That one, you are going to use the weight to build a stamina.
The dumbbells?
The dumbbells.
Okay.
We have the preacher curl. We have the barbell curl, easy curl, a lot of them.
Is that the same as muscle strengthening?
Yes. We have two types of workout. We have power workout and the strengthening workout.
What power workout?
Power workout.
Okay.
The power workout is when you are lifting heavy weight. That one, heavy weight is lesser reps, and the light weight is strengthening workout. So you go, the light weight is more reps with the light weight, and the heavy weight is lesser reps. The thing is, if you want to strengthen the body, you need lighter weight.
Okay.
You need lighter weight to strengthen the muscle.
Okay.
But if you want power training, then that one you add more weight.
Why do we need to strengthen the muscles?
The thing is, let me compare in this and our lifestyle in Ghana here. A lot of people, they don't like working out at the gym here and there.
Okay.
So by the time you reach like 30 years, you see the face and the here and there, the tummy will become like something.
Okay.
And the thing is, when your tummy become big, it's not good for your body.
That's true.
You have a lot of implication on your body.
I agree.
So the thing is, you need to work on your abs. It's very important. The first priority in human anatomy is the heart. So the second is your tummy.
Right.
So a lot of ladies, I want 6 packs, I want 6 packs, it's like that. So you need to work on your abs, your arms, your shoulders and your legs,
Okay.
your calves.
So in
To
other
firm up.
words, exercise makes you look good. It
Yes,
makes you look very
makes you look younger.
good.
Too.
Okay. Okay. That's good to know. Doctor, should everyone exercise?
I think so.
Everyone?
Yeah, everyone must exercise because naturally, that's how God made us. You know, as soon as a child is born, the child tries to move. Okay. Even when the child hasn't started walking, you realize that it starts crawling and then getting up to try to walk. So that is a natural tendency for every human being, actually.
To engage in some level of physical activity.
Yeah. And as Coach rightly said, it prevents aging. Okay. And at the same time, your heart, the cardiovascular system, when you exercise, you get a heart which is fit for the daily activities, prevention of diseases like hypertension, diabetes, okay, cancers, and so on. Okay. In fact, exercise is actually known to be an antidepressant. Okay. So that people who are depressed, when they exercise, it brings down, it has a lot of psychiatric benefits actually. Okay. You're able to sleep better, you're able to deal with stress and anxiety when you exercise. Okay. So definitely exercise has a lot of benefits so I think everybody must exercise.
You know, there are people who are bedridden. How do they engage in exercise? Yeah,
it's so important that you make mention of this because even in the hospital, when we have people being on the bed for so long a time, we want to encourage them to exercise, mainly to prevent a disease we call DVT, deep venous thrombosis. And that could be a very big cause of mortality in such patients. Okay. If I say mortality, I mean death, the cause of death in such patients. So it's important. So how do we do it? You need to be gentle because people who are bedridden are kind of weak and frail, so you want to take your time. Okay, so few things that you can be lifting the arms, putting it down, lifting the arm, and then lifting the legs as well. Palm, extension, and flexion. And then also you can do some movement about the ankle joint. You can do dorsiflexion and plantar flexion. That is moving the ankle joint this way and that. That prevents deep venous thrombosis, which is the #1 reason why you need to do exercise while you are in bed.
Okay. Yeah. So I guess that's what is done at the physiotherapy departments at the hospitals?
Yeah, it's one of those. Okay. It's one of those.
Okay. But is there a deliberate effort to make such people engage in some level of physical activity at our health facilities?
Yeah, we do that, especially in patients who have CVA or stroke, in stroke patients. Okay. As soon as the diagnosis is made that you have a stroke, you put on your medication, and then early physiotherapy is key. Okay. Yeah, that's early physical activity or physical therapy is key. So they come and try to move their limb, which is weakened, in order for you to pick up quickly and then get back to work.
Okay. Yeah. Thank you, Doc. Mr. Akwa, how much exercise do you recommend for your clients?
Okay, when you're about to start the workout, maybe for the first day, at least you need to spend like 30 minutes.
Okay. A day?
A day.
Okay.
Yeah. So you start with once a day, not twice a day.
I want to come in.
Yes, please go ahead, Doc.
When it comes to the amount of exercise that needs to be prescribed for an individual, generally on the average we say that, okay, you need, let's say 30 minutes of brisk walking or 20 minutes of running or moderate gardening for 20 minutes. I think that is average that everybody must do, but we need to also compare how much energy the person has taken in and then how much energy you want to expend. And there should be a balance. Right. All right. So let's say somebody who goes to exercise, runs for 30 minutes in a day, and then the rest of the day he's always seated and then taking in so much calories. I mean, that definitely will not balance out.
Right.
Yeah,
You
so
won't get a good result.
you not get a good result. Or in our setting, people go and run for about an hour and then sit somewhere to eat a lot of omutio with Guinness or beer. You know,
Right.
the
They're
amount of
replacing the
energy they
calories.
pile in after the exercise, you realize that they are not really getting the benefit out of it. So you need to know how much you are taking in and then how much you are, and then make sure you are exercising more to
Burn
expend
more
it, to
calories.
burn more calories.
Okay. I'm glad that you brought in this, but there's a WHO recommendation for us to engage in, I think, 18 to 64 age category. We have to engage in about 150 minutes of physical activity, moderate physical activity in a week.
In a week.
That's, 150 minutes. So if you're able to do at least 30 minutes
In
each
5
day,
days.
in 5 days, at least you are meeting the
Yeah.
WHO recommendation for physical activity. Doctor, we've heard about some crisis lately about physical activity. What is the issue? Because we are being advised to exercise, yet we hear that people are exercising and we are having some crisis.
Yeah, thank you. I think this is so much important because now that we are talking about physical activity and hammering on it in the hospital, so now people are trying to catch up. Like, okay, my doctor says I should keep walking, I should keep doing that and all. How do I do it? Or what could result from the physical activity that you engage yourself in? That's a question. I think it's a good one. One, let's say you are somebody who has ischemic heart disease. If I say that, I mean you have somebody who has suffered a heart attack before. Okay. And then your doctor tells you you need to exercise. So the following day, the person registers with the gym, and then you see him on the treadmill going and taking on. And we've heard such stories before outside this country and even in this country recently. Yeah. So if you do more than your heart can contain, you're probably going to have a heart attack again, and then you can die. Okay? You can also have, if you're somebody who has underlying arrhythmic problems, cardiac arrhythmia. If I say cardiac arrhythmia, I mean, you know, there's a way that the heart must beat. If yours beats in a different synchron, a different way, and then you put yourself on the treadmill and do so much, you can have cardiac arrest. Okay? So you need to know your heart condition and then, or your ability, your strength, to put it in a simple way. And that should determine how much exercise you want to do.
Okay.
In order not to. So having a heart attack is one of them. Okay? Having a cardiac arrest is another. Okay?
How about hypertension?
If you're hypertensive, I think these treadmills have heart rate and blah, blah on it.
Okay.
Yeah. Ideally, you should have your BP checked. You should have your heart rate. And sorry, when you are going overboard, then you need to tone down a bit.
So please let me ask Mr.
Okay, I'll come in
do you
later.
really monitor these things when people are
Yes,
at the gym
yes.
exercising?
Monitor. But the first thing is, when it has a problem like that, when you go to the gym, the first thing to do, let the instructor know you have this problem here and there.
Okay.
You have to let the instructor know that you have a lot of, maybe your BP is this here and there. You have a problem with maybe heart enlargement or here and there. So if you let that person know that you have this kind of disease, he can assist you. Maybe 15 to 20 minutes, sit and rest for a while.
Okay.
But if you come and you register,
You are on the blind side
blind
of their
side here and
health
there,
status.
you're working out, all of a sudden then,
Boom.
maybe. So the first thing to do is maybe you can bring your resource or your thing to the gym.
Right.
To let the instructor know that you have something that will not help you. Your physique.
Stomach pain. He's got flu.
Come, you two.
Both of you.
Both?
The illnesses are different, but the problem of both is the same.
Same?
Germs. When germs go from hand to mouth, they cause illnesses like stomachache. And when germs go inside the nose, they cause illnesses like flu. The symptoms are different, but the protection remains the same.
New Lifebuoy with Active Natural gives 10 times better protection from infection-causing germs.
So I think that for me, I'll personally call for a collaboration between medical doctors or healthcare professionals. Once they recommend that one should engage in physical activity, at least they can come with a prescription indicating their health status and some restrictions, because we cannot just say go and exercise or go and engage in physical activity.
Exactly.
We need to let them understand that there may be risk and that they need to be monitored during physical activity.
Exactly.
Yeah. Doctor, I think you wanted to add something.
Yeah, I wanted to add a few things. Side of the world is quite hot. Okay, so if you are doing exercise, one way that you can suffer is if you're not catching up with water, dehydration. Okay, you do so much exercise, you need to make sure you are rehydrating yourself so that you don't get dehydrated. Again, strenuous exercise for a very long time can make you break down your muscles. Exactly. And that can release potassium, and that can lead to arrhythmias, which can also lead to a cardiac arrest. So doing strenuous exercise beyond you should be a no-go area. Just tailor it down to your needs and your strength, and do how much you can.
Okay. So I have another question. You know, sometimes when you exercise, you itch. Are there concerns? Should we be worried about that?
The thing is, when your body starts itching, maybe you're on the treadmill, start sweating, then the body is itching. Maybe you gain weight, then the fat accumulates. It starts itching. So it will start like 10 or 15 minutes. Don't stop. Don't hang your shoes. Some of them, when they start itching, they will stop coming to the gym. They don't want to come back to the gym again. That one, keep working out. Maybe that very day, when you continue working out on the treadmill, maybe 10 to 15 minutes, then the itching will stop. So that one, don't hang your boot at all.
So it's normal.
It's normal.
We shouldn't be worried when we are itching.
Yes, when you are itching. Yes.
Will you have a medical explanation for that?
Yeah, exactly. One of the reasons why we itch, I mean, everyone itches when he or she is starting to, exercise. And one of the reasons is that maybe your clothes are so tight, the kind of clothes we use in exercise, and when it scratches your skin, your body releases something we call histamine. Okay, and histamine is responsible for the itch. Okay, if I say histamine, is the same chemical which is responsible for you having hives or urticaria, bumps. Okay, it's the same thing. And also the heat that you produce. Okay, the heat you produce when you're exercising also causes this histamine to be released, and that causes the itch. Sometimes too, you may have people who probably would have bathed with some form of soap, which will still be on the skin, and when the sweat touches it, they may react. Or even the cloth, the kind of fabric you have. Some people react to cotton and other forms of fabric, and that can also lead to the itch. But as Coach rightly said, generally you shouldn't stop exercising because of the itch, because it will just pass by. I mean, nothing will happen to you.
So histamine in the blood is not a cause to worry about?
No, histamine is always with us. I mean, it's in us. Yeah, but when you're having big bumps, okay, let's say you're having big bumps, like very huge bumps on the skin, and it's so itchy and you can see them, okay, then you need to probably stop and seek for medical attention. Generally, you may not have that, but it could be as a result of allergic reaction, for which reason you need to see medical attention.
So how about eating? I realize that sometimes when you eat, and I mean within a short time you try to exercise, you feel heavy on one side of the stomach. I don't know whether it's just me or it's something normal. What's the reason? Should we wait a while after eating before exercising?
Yes,
or
that one is very important.
Okay.
But it's like the time is for 4 o'clock, then you eat in between, then at 5 o'clock you start working out. It's not good at all. It's supposed to be 2 or 3 hours interval. That time the food would digest or settle. But if it's like you finish eating at 4 o'clock, then 5 o'clock you're on the treadmill, you get cramps.
You're interfering with digestion.
That one is very, very important. So at least you need to, 2 or 3 hours interval before starting your workout, your treadmill or your cross trainer.
Well, generally, it's advised that when you before you exercise, it's advised that you eat. You eat something at least little, so that you can get energy, especially carbohydrate-rich diet. That will give you a lot of energy to help you do the exercise and do it quite well. But the kind of food you eat will determine the amount of time that you need to wait before you start the exercise. Let's say if you want to start the exercise in a matter of an hour, then you need to take in something liquid, maybe some breakfast kind of diet, and then within an hour, because that will just go through the stomach quickly. But if you are going to take something huge, like fufu or mutu or something, then you need to wait for at least 3 to 4 hours. Let the food just go through the system, settle down, as you said. Yeah, and then you can start with the exercise. You can also be eating as you exercise. Some people are trained to do that.
As we exercise.
As you go through, you can take in something little.
Like fluids or...
And snacks and fluid, yeah.
Or your banana.
Banana, something.
If you want to build mass, you need a lot of protein.
To keep you going. But that should come in bits, like bits and pieces, you know. Because mind you, though you are careful with the amount of food you eat, you need energy to keep you going and doing that. But if you take in huge amount of food, you're going to have this abdominal cramps here and there, and that will not help you. And you also feel so down, all right, down, and you can't do the exercise so well. So you need to balance it out, feel light, whilst you still get the energy, and then you go through the exercise.
So, Mr. Kwa, your final words to our viewers.
Okay, my final words for the viewers, at least everybody should exercise at least 3 to 4 times within the week. Walk, brisk walking, playing soccer, go to the gym, visit any gym you like. But it's very important for your own sake. Thank you so much.
Doctor, your final words.
Recently, we all heard about the demise of our former vice president. And I think we can learn something from it. Every gym must have something we call an AED, that is an automated external defibrillator. What this AED does is that it helps you in the basic life support. Every coach or every gym user must know how to go through the basic life support. This is basic. And all that is saying is that you should be able to perform a CPR, that's chest compression, on everyone who falls down while exercising.
Okay.
And the most important ingredient in your basic life support is what we call the AED. The AED is just a small machine which, when someone falls, you just attach. As soon as someone falls, the first thing is to start the CPR, that's chest compression, while someone quickly gets the AED, which is a small machine, which you just attach to the patient's chest this way. And as it delivers the electric shock, you may have the person surviving. And as you do that, ambulance should be called. And then quickly, you take the patient to the hospital. I mean, this is basic. It's done in the Western world, of course. And we can also bring it here. And it can save lives. So I would advise that every gym has that. And again, when you are going to the gym, inspect that they have an AED. And this is not supposed to only be at the gym, but also swimming pools, at the bar, at the nightclubs, in schools, in churches, wherever you have people congregating. We need this AED. And as soon as somebody falls, it will be a lifesaver. Thank you.
All right, doctor, I hope this AED is not so expensive.
Well, I think it's less expensive than life, so we need it.
It's less expensive than life. You said something off camera. It's less expensive than a coffin. I like that. I like that. All right, viewers, this has been the WowLifeStyle show. You know, you can start in bouts of 10 minutes of physical activity. Exactly. So don't give up. Physical activity is still important. And the WHO recommendation of 150 minutes a week is key in maintaining good health. So at the end of this show, we're going to do a few aerobics. If you are at home, just join us and enjoy. Thank you for watching. See you next week.
4 and 5. Switch legs. Left. Ready? Start. Good. 1, 2, 3, 4, and 5.
6.
Good.
7.
Move.
8,
2 more.
9.
1 more. And 10. Yeah. This way. Okay, ready? Go. Down. 1. Count. 2. I can't hear you.
3, 4,
Good.
5, 6, 7, 8, 9,
and 10. Good. 4. Keep the legs straight. 5. If you don't count, you get tired.
6,
Very good. 7. Nice one. 8. 2 more.
9.
1 more. And 10. Come up slowly.
Wow, I can feel this one.
Yes. Now,
I can
the
feel
legs.
this one.
5. Very good. Now, I've done the right leg. You know what? The sitting also is very important. Don't sit like this. If you sit like this, you are spoiling the spine. So you keep your back straight to save your spine. Then you stretch your arms over your head. Straight. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Very good.
All right. Thank you very much, Mr. Akwa. See you next week. Bye-bye.
Bye.